So you want to fix the system, stop the lawyers. You want to fix the system, take the greed out of the system, take the fat out of the system. But don't destroy the greatest system on earth. You don't have to destroy I'll use a petty metaphor. You don't have to throw the baby out with the bathwater. Throw out the dirty bathwater. We have a fine medical system. Stop the lawsuits. Cap them at $250,000. Find out the medical fraud in Medicare, Medicaid. Find out how much medical fraud, how many billions of dollars a week are being stolen in medical fraud, in false claims. Okay? Do it. Clean it up. Spend $1 billion on lawyers to track that down. Then you're going to have a cleaner, meaner medical system. But don't destroy the whole system and turn it into a socialized medical system. I don't think anybody would argue with that. And then, of course, I have another idea, another plan. Because there are so many greedy cranks who are abusing the system, who have money of their own, you must make them copay at every visit. Every visit should cost $25 at the very least. Because that would cut down on the cranks who are going from doctor to doctor for the attention and the fun of it. Remember, what if you're retired and you have nothing to do? You have no family that talks to you because they're sick and tired of your complaints. You have no friends. You have nobody in your life except your doctors. So you have a suitcase with folders: neurologist, optometrist, ophthalmologist, cardiologist, neurologist, psychiatrist, all for free. And you go 4 or 5 times, 6 times a week, maybe more, and there's no co-payment. Now, you may not have much money, but think of the fun you're getting. You get to sit in the office, you got your legs crossed, the doctor comes in and you show her how smart you are. You pull out your file and you start lecturing her on your condition, and she has to listen to your abuse. And the doctor tells you there's nothing wrong with you, you threaten to sue her. So she orders another test, and you go home feeling that you made money that day. You got something for nothing. You robbed the American system of a big procedure. So although you don't have the money in your pocket, you have a satisfaction that you stole a $500, $1,000 something out of the system. You don't understand the mind of petty criminals, do you? There's actually a negative to some of them. That although they don't make any money from it, they feel as though they worked by the free treatment that they got. Charge them $25 a visit, and they might stop coming. So what's wrong with co-payment? So you say, I don't have any ideas. I'm just disruptive or I'm comedic in the political arena. You're all wrong. Remember who the hell you're talking to here. Just remember who the hell you're talking to here, you left-wing Democrat phonies, you. I know more about this than you might imagine. You want to clean up the medical system, rein in your filthy lawyer friends, and rein in the false patients, and throw the damn illegal aliens out of the medical system. Get them the hell out of our hospitals. Get them the hell out of our doctors' offices. They've bankrupted the medical system. And the reason you let them do it is because you knew the day would come that if they could screw things up enough, your dear friends, your illegal alien friends, then you could declare that the system is broken and you'll fix it. You broke it by letting them come in here. You broke it by encouraging these freeloading lice to take advantage of our system. You broke it. So don't think we're that stupid. And if you think I have no solutions, I've just given you 2. Let's get down to brass tacks. You want to fix the medical system? Cap medical liability at $250,000. Let them all move to France if they want to sue, because I think there's no liability there at all. I don't think they can sue in France. Or if they do, the tort cases in Europe are much different than here. Lawyers don't have the freedom that they have here to rape businesses and rape individuals in Europe, like the vermin can do here. The vermin who otherwise wouldn't have made a dime in your life because they're so negative. These ambulance chasers. But anyway, so as I say to you, rein in the lawyers with a $250,000 cap on medical liability, number one. And number 2, throw the illegal aliens out of the... Have no citizenship? I'm sorry, amigo. Take a bus south and get treatment in Calixico or Guadalajara. You have wonderful medical care down there. It's so wonderful. That's why you came here. Take a bus ticket home. We can't afford it anymore. Now, I'm not a heartless man. We're not talking about a guy in a car wreck or a child who fell out of a window. Of course you have to treat them. I am talking about the people who are coming here across the border who are not citizens for bypass surgery, for stents, for brain surgery, to give birth to babies that become instant citizens. Put the National Guard on the border. Take the troops out of Okinawa. Take the Marines out of Okinawa. We have 30,000 Marines in Okinawa. The war ended in 1945. Why do we have 30,000 Marines sitting in Okinawa? Why do we have a military base in Germany? The Russians are not invading Western Europe. Where we need them is on the border with Mexico. That's where we need the troops. We don't need them in Okinawa and in Germany, do we? You talk about a country that's upside down, run by dunces. This is a country upside down, run by dunces. Take the Marines out of Okinawa, put them on the border with Mexico. Close down a military base at, I believe it was Ramstein, isn't it? I don't know where it is. Take them out of Germany and put them on the border with Canada. You want to secure Fortress America? That's where you begin. You want a fixed medical system? I'll give you another rule. I'll give you another idea. Rein in the lawyers, $250,000 cap, number one. Number two, co-payments, $25 per visit minimum. I don't care if you're homeless and you don't have a dime. Then you owe it to the country. Then you run a bill. Okay, so the first money you get, whether it's from the lottery or from your grandmother, you pay the country back after you got the lottery win. That's number two. Number three, no ticky, no laundry. You're not a citizen, you get no medical care in this country except in an extreme case of an accident or so forth and so on. No primary care for the bambino. No, N-O. No ticky, no laundry. We can't afford it anymore. So those are three things. Would you like a few more? Because I'm doing this for you at $1 a year. I'm providing you these services for $1 a year. You want another czar in this country? Obama has about 70 of them now. People report only to him. How about making me the czar of medical reform? I'll do it for $1 a year, Dr. Obama. I've already given you two more positive ideas than all of the dunces with senatorial degrees can offer. Has one of these schmucks called senator said first rein in the lawyers, cut off medical care to illegal aliens, make people pay $25 a visit? Not one of these stooges in the entire government has said that. I did it for you for free. I'll be your czar of medicine for $1 a year. I'm Dr. Michael Savage. I'll be right back. Savage.